When using cladribine vial, it will be administered by a healthcare professional through an injection into a vein. Your doctor will provide specific instructions for the dosage, which is typically given continuously for 7 days based on your weight and response to treatment. It's important to avoid getting the medication on the skin or in the eyes, mouth, or nose. If this happens, flush the affected area with plenty of water and notify your doctor immediately. Remember to always follow your doctor's guidance when using this medication. Some common side effects of cladribine vial include nausea, vomiting, dizziness, headache, cough, diarrhea, joint/muscle pain, trouble sleeping, stomach/abdominal pain, constipation, or pain/swelling/redness at injection site. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist right away. Although this medication may have serious side effects, it has been prescribed to you because your doctor has determined that the benefits outweigh the risks. Your doctor will carefully monitor you to minimize potential risks. Contact your doctor immediately if you experience any serious side effects, such as pain/swelling/redness in your arms or legs, or shortness of breath. While a severe allergic reaction to cladribine vial is rare, seek medical help right away if you notice symptoms like rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that cladribine can cause a mild rash, which is usually not serious, but it may be difficult to distinguish from a rare rash that could indicate a severe allergic reaction. If you develop any rash, seek medical help immediately. This is not an exhaustive list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. In the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before starting cladribine, make sure to inform your doctor if you have any allergies or if you are allergic to it. It's important to also discuss any medical history, especially if you have kidney disease, liver disease, nerve/muscle disorder, blood/bone marrow disorder, or any recent/current infections. This medication may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. Limiting alcoholic beverages is also recommended, and if you are using marijuana, talk to your doctor. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's important to let your healthcare professional know that you are using cladribine before receiving any immunizations or vaccinations. It's also advised to avoid contact with people who have recently received live vaccines, such as the flu vaccine inhaled through the nose. Cladribine can make you more susceptible to infections or may worsen current infections. It's important to stay away from anyone who has an easily spread infection, like chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, make sure to talk to your doctor for more details. To lower the risk of getting cut, bruised, or injured, use caution with sharp objects like razors and nail cutters, and avoid activities such as contact sports. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor. It is not recommended to become pregnant while using cladribine, as it may harm an unborn baby. Reliable forms of birth control should be discussed with your doctor. If you become pregnant, make sure to talk to your doctor right away about the risks and benefits of this medication. It is unknown if this drug passes into breast milk, so breastfeeding is not recommended while using this drug. Consulting your doctor before breastfeeding is essential. It's important to be aware of potential drug interactions when taking cladribine vial. These interactions can affect how the medication works and may increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval. Some products that may interact with cladribine vial include other drugs that weaken the immune system or increase the risk of infection, such as cyclosporin, natalizumab, rituximab, and drugs to treat cancer like irinotecan. It's also important to be cautious of other drugs that worsen kidney problems, including NSAIDs like ibuprofen. Be sure to discuss any concerns about potential drug interactions with your healthcare provider. Remember to take cladribine vial exactly as prescribed and at the recommended time for the best results. If someone has taken too much cladribine vial and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to call 911 or a poison control center right away. Symptoms of overdose may include weakness, numbness, or tingling in the hands and feet, inability to move the arms and legs, changes in the amount of urine, signs of infection like a persistent sore throat or fever, easy bruising or bleeding, unusual tiredness, and a fast or pounding heartbeat. If you have any concerns about cladribine vial, be sure to talk to your healthcare provider for more information. It's important to undergo lab and/or medical tests while using cladribine vial, including complete blood count, hemoglobin, platelets, and kidney/liver function tests. Make sure to keep all medical and lab appointments and consult your doctor for more details. Be sure to take each dose of cladribine vial as directed by your doctor. If you happen to miss a dose, it's important to consult with your healthcare provider or pharmacist to establish a new dosing schedule. Be sure to follow the storage instructions provided with the product and ask your pharmacist for more details. It's important to keep all medications out of reach of children and pets. Do not dispose of medications in the toilet or sink unless specifically instructed. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.